Hello, welcome to the Radiology Economics and Policy Learning Electronic Toolkit, REPLETE. This program was made possible through a GE Healthcare RSNA Education Scholar Grant from the RSNA Research and Education Foundation. I'm Rich Duzak from Emory University, and this session is another part of the Follow the Money portion of this series and entitled the Medicare Physician Fee Schedule. This module is targeted to Level 2 of the Diagnostic Radiology Milestones Project of the Accreditation Council for Graduate Medical Education and the American Board of Radiology. Milestones levels differ for the various ACGME-approved radiology training programs, and so if you are in a program other than diagnostic radiology, please refer to the REPLETE resource webpage for mapping this module to the correct level for your program. The learning objectives for this module are as follows. To utilize Medicare allowable fees as a surrogate of the costs of imaging services and procedures. To understand how Medicare payments vary based upon types of services and sites of services. And to state the relative costs of various common radiology services. Here are some additional resources listed alphabetically by author for those who would like to learn more about the topics in this module. Typically, decisions about which imaging studies to order or not are made by our clinical colleagues, often without any conversations with us as radiologists. As those physicians are increasingly being asked to engage with their patients in shared decision-making, however, their overall poor understanding of the costs of common imaging studies could interfere with their ability to make those conversations as meaningful as possible. For example, in this study that we discussed in the last module, only about 1 in 6 physician trainees can state Medicare allowable fees within 50% of the correct amount. But before we criticize our clinical colleagues too much, we need to understand that we, as radiologists, aren't much better. When asked about Medicare allowable fees, something that many use as relativity benchmarks for the cost of imaging, only about 1 in 3 radiology residents comes within 50% of the right answer. So there are lots and lots of opportunities for us to help our referring physicians and our patients better understand the costs of the services we render. And remember, this isn't just a hypothetical exercise about potential opportunities in shared decision-making. As I indicated in the last module, patients are increasingly seeking this information. You can see here from a Google Trends analysis of the simultaneous keywords MRI and cost how much patients are turning to the internet to try to find this information. Patients coming to you for a brain MRI, for example, will often want to know whether they'll be paying $100, $300, $500, $1,000, or maybe even more for that test. And it will be increasingly incumbent upon us as radiologists to help them. So this module will focus on introducing you to some tools to be able to answer those types of questions, and potentially start thinking about ways that you can help in a more systematic way across your health system to make this information more transparent to your radiology colleagues, to your referring physicians, and of course, to your patients. In this module, I will try to outline for you the process by which you need to follow to get this information. In doing so, we'll build upon some of the information you learned in prior Level 1 milestone modules. Here's the approach. You'll need to have a specific service in mind. And then you'll need to find the right CPT code to describe that service. And if you're looking to use Medicare allowable fees as your reference standard, and I think that's a good place to start, you'll need to map that code to the right fee schedule amount. Now, you won't need a secret decoder ring to get you from one step to the other, although I must admit that the steps can seem a bit cryptic to the uninitiated. My mission is to make that all a bit more transparent. I already showed you that patients are frequently going to Google. Is that a good place for you to start? Well, at first glance maybe, but I think not really. If, for example, you want to look up the CPT code for a chest radiograph, you'll get an autofill menu that looks something like this. And clicking those choices will give you a list of options that look something like this. But I would caution you against going this route, because it will take you to a bunch of random sources on the internet, some from private practices, some from hospitals. These may or may not be accurate. Remember, what you find on the internet may or may not be correct. The most authoritative source of CPT coding is the CPT code set itself from the American Medical Association, and it's all in the CPT codebook. Your coders in your department and your business team almost certainly have copies of this that you can use. I would encourage you, if you're interested in this kind of material, to familiarize yourself with that book. Here's a screenshot from a page of the 2017 version PDF. And if you turn to this page in the radiology section for chest in your book, you'll see codes for radiography and CT. And if you turn the page beyond what I'm showing you here, you'll see MRI as well. In the fine print underneath the chest in red, you'll see that CPT code 71010 describes a single view chest. But make sure that you use the right book. I'm recording this session in late 2017, and so I'll be using the 2017 fee schedule as the basis for the rest of this lesson. But the 2018 book has just been released, although the codes for it have not yet gone live. It indicates that the code for a single view chest radiograph will soon change from 71010 to 71045. So here's my point. If you're using CPT codes to find the right allowable fee, you need to make sure that you have the right code at the time that you're doing your search. There are other resources as well. Many coders and other professionals will use online tools. As a member of the AMA's CPT Advisory Committee, I have access to a licensed product from Optum called Encoder Pro. I'm not endorsing that product or any other competing product that's out there, but simply pointing out that these are complementary resources that may be available to you within your health system. In this tool, for example, if you type in CXR for chest x-ray in the search bar, you'll see the menu that pops up listed here. And under that, of course, you'll see some hyperlinks for CPT codes for chest x-rays. And if you click that code range hyperlink, you'll get a screen that looks like this, not dissimilar to the listings that I've shown you from the CPT codebook. But these also have lots of active hyperlinks to get you more information without going through some of the additional steps that I will soon be describing. So while all of this seems like a more streamlined solution than what I'm going to be proposing to you, it's also quite pricey. And as such, these tools may not be available to you as an individual through your health system. Let's go back to the big picture. Again, we need to identify a service, we need to identify its CPT code, and use that to determine Medicare fees. So for illustration purposes, let's again pick that single view chest x-ray. As I indicated in 2017, that's CPT code 71010. You see the descriptor listed here in yellow. By the time you're viewing this, it will likely be 71045. But the fee schedule resources for that aren't yet available, so I will walk you through this exercise using 2017 fees. You now have the code, and that's a good place to start, but it's only a start. You'll then need to get to the Medicare Physician Fee Schedule Lookup tool. Here, I think Google, or whatever search engine you may like, is your friend. Medicare not infrequently changes its various page links, so I usually go to the lookup tool this way rather than trying to navigate the CMS website. It's not always user-friendly, and it changes from time to time. And at this point from Google search, you know what to do. Click the relevant link. And it will then take you to this page. There, you'll click the link for the Physician Fee Schedule Search radio button. And then you'll have to agree to a few nag screen things, but here's what you'll see. At this point, we'll pick the year that we want, in this case 2017, because that's when I'm recording this session. Occasionally, though, you may want to look back in time. Older years are available in the drop-down menu. And here, we're going to be looking for pricing information. Most of the time, you'll be looking for just a single HCPCS code. Remember, we talked about the Healthcare Common Procedure Coding System, HCPCS, in a prior module. HCPCS is largely comprised of CPT codes, but it also includes some codes that were established by CMS, the Center for Medicare and Medicaid Services, for services that are not described in the CPT code set. You may want to look up fees for your particular area of the country. In a future module, we'll talk about regional variation in Medicare payments using Geographic Practice Code Indicators. The acronym is GPCI, sometimes colloquially called GPCIs. That variation isn't very much, though. And for what we're doing here, and I think for the benchmark purposes that most radiologists want, national payment amounts will suffice. Then you'll type in the CPT or other HCPCS code of interest. Remember, 71010 is the code in 2017 for a single view chest x-ray, and that's what I'll be illustrating here. And finally, you will want to select all modifiers in this drop-down menu so that you can get as much information as possible. When you do all that and click Submit, you'll get a screenshot that looks like this. In a future module, we'll talk about the differences between professional fees, which are indicated by a 26 modifier. That's what a radiologist gets paid, and the technical fees, which are indicated by a TC modifier. That's what a private imaging center or physician office gets paid for its non-interpretive work, things like equipment, administrative, and technical staff. The unmodified row above both of those, at the top, shows the global fee. That's the sum of both of these. And that's a pretty good benchmark of what Medicare nationally pays for these services. And you'll see, $22.97 is the amount for that single view chest x-ray. If you scroll to the right, you'll see how payments for the technical component vary considerably under another fee schedule, OPPS. That stands for the Hospital Outpatient Prospective Payment System. As a general rule, hospitals get paid a lot more for their technical services than do private offices. So a chest x-ray that Medicare pays about $23 for in the office setting will get paid about 3 times as much, that's $69 in the hospital setting. Importantly, the radiologists will get paid the same in both circumstances, about $9. So that difference is entirely in what the facility gets paid, that is, the office or imaging center or hospital, and not you as the radiologist. Now that we've gone through this on the individual level, let me show you how you could approach this for different modalities across a body region. For this exercise, we'll focus on abdominal imaging. Here are the relevant pages from the CPT book. Radiography, CT, and MRI are all in the radiology section of the book that you see on the left. For some quirky and historic reasons, ultrasound is in an entirely different section of the book that I've listed here on the right. For the purposes of completeness, I've included that page as well. Now, in the interest of time, I've already gone through the tedious exercise of looking up a bunch of reference codes, and I've listed them here. Radiography, ultrasound, CT, and MRI of the abdomen. And I've looked up each one in the Medicare Physician Fee Schedule Lookup tool and listed allowable Medicare fees for each one. Remember, global fees are your best benchmark for stating the relative costs of services. The PC or professional component column, that's the 26 modifier stuff from a prior slide, refers to the radiologist portion for his or her work. And the TC column is what the imaging center gets paid. That's the technical component. You'll see the amounts rise as you go from one modality to another, from radiography to ultrasound to CT, as well as if you expand the area imaged from CT of just the abdomen to the abdomen and pelvis together. Let's look at what happens in abdominal imaging in a graphical manner. That may be a little bit easier to digest as you go from one modality to another. For radiography, there's a few choices here. I've illustrated a 1-view abdomen and a 2-view abdomen, and the payment here, global payment, somewhere around $40 for Medicare. Ultrasound, there's 2 different flavors of that, a limited ultrasound and a complete ultrasound. We've talked about those in the past. We're talking in the ballpark of $100. CT, again, 3 flavors, without contrast, with contrast, or both pre and post contrast. And again, the price varies quite a bit from one to the other, but we're talking in the ballpark of $200. And how about MRI? Well, we jump up quite a bit again here, $500. Each time you go from one step to another, you roughly double the relative price. There are different codes for CT of just the abdomen and CT of both the abdomen and pelvis, as I've already mentioned to you. Let's take another moment to talk about that. Remember, in the prior CPT module, we talked about the 3 different types of codes for CT, as well as MRI for each body part. No contrast, contrast enhanced, and pre and post contrast. And again, there's different codes depending upon whether the body part is just the abdomen or the abdomen and pelvis. Each of these increases the cost of the service, and overall we go up as we add more contrast, increase the complexity of the examination, and increase the portion of the body imaged. But going from an abdomen to an abdomen and pelvis, whether without, with contrast, or both, roughly increases the relative price by about 30%. You can do the same for any codes that you would like going through the process that I just walked you through. I'll quickly highlight brain imaging. Again, go to the CPT book, find the codes you want, and then map them to allowable fees. For brain imaging, you will see a similar trend. Radiography, ballpark $40. CT, ballpark $100. An MRI, ballpark $300. So again, on average, relative costs will a bit more than double each step along the way. But remember, these are just benchmarks. These are just relative costs. As we talked about in the prior module, these costs can vary considerably from payer to payer, depending on the type of plan that the patient has. So they're just general reference benchmarks. You will need much more specific information to be able to determine patient out-of-pocket costs at the individual examination level, depending upon where the patient is with regard to his or her healthcare costs at any point during the year. And these costs vary considerably by sites of service, as I've already briefly highlighted. There are sophisticated tools that your health system can license to help get your patients the information they need to make good decisions and to best manage their expectations about cost. That should be a goal for all of our practices. So in summary, most physicians, radiologists and non-radiologists alike, know little about the costs of medical imaging. Medicare fees are publicly accessible, but as I think I've illustrated to you here, they're not necessarily easy to ascertain. Nonetheless, they can serve as benchmarks to help physicians better understand relative costs. But remember, out-of-pocket costs borne by patients can vary quite dramatically. Ultimately, we need better information to be able to guide our referring physicians and our patients as we all collectively increasingly participate in shared decision-making. To ensure appropriate credit for this module, please make sure that you complete the accompanying online quiz from the RSNA's e-learning platform. More information on the Replete initiative and additional resources are available on the RSNA's website. I'm Rich Duzak from Emory University, and I look forward to helping you continue along your economics and health policy milestones journey. Again, thank you for participating in Replete.